Bismillahirrahmanirrahim. So today's discussion is going to be about the clinicals of the radial nerve. So let's just discuss the course which is clinically relevant for solving the MCQs. So we know that it comes up from the posterior cord of the brachial plexus, and it is the largest nerve which is coming off from the brachial plexus, and the root values are all the values which are involved in the brachial plexus from C5 to T1. Okay, it is given off in the axilla. So first of all, let's just see that here it is given off in the axilla, where it is going to give a branch to the one of the heads of the triceps. After giving one branch to one of the heads of the triceps, it's going to move forward and it's going to pass to the spiral group. I'm going to draw it with dashes. Okay, this is the hypothetical humerus. And since spiral group is present posteriorly, I'm going to represent it with dashes, and it's going to pass to the spiral group, where it is going to give another branch to one of the heads of the triceps. Okay, so let's say this is point A in the axilla, where it's giving a branch to one of the heads of the triceps, and this is point B in the spiral groove. Okay, and now after that, what is going to happen is that it is going to pass downwards. It's going to come in front. Okay, it's going to twist around the humerus and come in front and pass in front of the lateral epicondyle. But before passing downwards in front of the lateral epicondyle, it's going to give off another branch to extensor carpi radialis longus. Please remember this. And this is going to be given above the lateral epicondyle. Okay, you can see this is the lateral epicondyle, and after giving off this branch, it is going to be passing downwards in front of the lateral epicondyle. Okay, and this is point C, where it is passing in front of the lateral epicondyle, and then it is going to divide. One branch is the superficial branch. We know it's going to be supplying the dorsum of the hand, the lateral 2.5 of the fingers, except the nail beds, which were going to be supplied by the median nerve. Okay, so this is the superficial branch. And then the other branch, which is going to be supplying the extensor compartment over here, we know it's going to pass below the deep to the supinator. It's also going to be piercing it and entering the extensor compartment, and over here this is now called as the posterior interosseous nerve. Okay, now this posterior interosseous nerve is going to supply all the extensor compartment. So the extensors, now one major one I'm going to be mentioning separately is extensor digitorum. Just remember that extensor digitorum is over here from the posterior interosseous nerve, and it is basically an extensor of the fingers mainly. And this extensor carpi radialis longus was the extensor of the wrist. So these two I've mentioned separately. Note their positions, that where are they given off. Okay, so now we are done with the main course that is needed for MCQs. So point D is posterior interosseous nerve. Okay, so now let's just start with the cases. The first case, that case A, refer back to the axilla. If the nerve is, gets damaged in the axilla, usually it is because of long crutches, excessive use of long crutches. So it's known as the crutch palsy. What is going to happen if the nerve goes off over here? Whole function of the nerve will be gone. Okay, so all the functions will be lost. So what will happen? Flexed elbow will be there, because extension will be completely lost, because this nerve is not been given off yet, and even this, so no supply to triceps right now. So there will be a flexed elbow. Okay, and then there is going to be a wrist drop, definitely a finger drop, because all these extensors are gone, and definitely going to be a sensory loss. So if someone asks you that the axillary nerve is spared in the severed in the axilla, what is going to happen? These are all the things. Every function is going to be lost. Next case is case B. That is the spiral groove. Okay, so if there is going to be damage to nerve in the spiral groove, what do we call it? We basically call it Saturday night palsy. Okay, in the axilla it was called as the crutch palsy, but over here it's called as the Saturday night palsy. And what happens in this case? You can tell that now if nerve is gone or damaged in the spiral groove, it has already given off a branch of triceps. So will extension be completely gone? No. So in this case, what is going to be happening is a weakened extension of elbow. Weakened elbow extension is going to be there. Okay. Why? Because branch has already been given off in the axilla to the triceps, but since it has been damaged in the spiral groove, all the other branches distal to it are going to be non-functional. So all the other remaining things which were in the crutch palsy are going to be there, except for flexed elbow. We will have a weakened elbow extension, but we will, in this case, we will also have wrist drop, finger drop, and sensory loss. All these things are going to be there. Okay, now we're going to talk about the third case, which is the case C. So have a look Again, in front of the lateral epicondyle, mostly, yeah, in front of the lateral epicondyle, mostly in case of the fractures of the lateral epicondyle. So what is going to happen in this case? We can see that which branches are spared? Axilla is spared, axillary branch, so triceps, both triceps branches are spared, so elbow extension is going to be normal. And extensor carpi radialis longus is also spared because it was given off before it passed in front of the lateral epicondyle. So in this case, this was a wrist extensor. So wrist extensor is spared. So will wrist drop be there? No. Wrist drop will not be there. Wrist will be fine. Okay, it will be easily extended. So in case C, where lateral epicondyle is damaged, we are going to have only finger drop and sensory loss. This is what confuses students because they forget that this branch to extensor carpi radialis longus is given before passing in front of the lateral epicondyle. So that is why they always think that, okay, wrist drop will also be there, but wrist drop is not going to be there. Why? Remember this muscle is spared because this nerve was given off before passing in front of the lateral epicondyle. Now, the third case, the point D, is the posterior interosseous nerve, and mainly it is gone in case of fractures of the radial head. If a scenario gives you a radial head fracture, so what is going to be there? In this case, we are not going to have sensory loss. Why? Because if this portion is spared, let me use the other mark. If this portion is spared, sorry, not spared, if this portion is damaged, this whole portion, will superficial nerve will be involved? No, it is given off before the posterior interosseous nerve passes through the supinator. So superficial nerve is spared, and all the other functions that are present proximal to it are spared. So only these extensor compartment function will be lost. So there will be finger drop, only finger drop.